I'm Dr. Lance Davis, Medical Director of the Hyperbaric Medicine Program at Roper Hospital. Now I want to speak about how to recognize dive-related problems, how to triage them based on their level of severity, and then how to access care here locally with us or in general to the proper level. In other words, not underreacting or overreacting, who to call first, how to structure your thinking about a potential emergency, a real emergency, or something that just needs medical attention but maybe not a true emergency. Let's think about our basic ABCs of life support. That's usually the mnemonic most people are familiar with CPR. It has been changing a little bit recently, but still the letters ABC are in there. And let's add the letter D for disability or neurological, central neurological really, the brain and the main nerves coming out of it. So if we think about ABC, airway, breathing, circulation, and D, disability, neurological, that pretty much covers the areas of concern that would constitute a dive-related medical emergency. So if someone's not supporting their airway because they're not conscious or they're not coherent enough to do so, or because there's an airway problem, swelling, inhalation of water, spasm of the larynx, breathing, the person is having trouble taking a breath, or they're having pain with breathing, or they're having increased work of breathing, they can't catch their breath, or they're really having trouble breathing. That's all emergency stuff. Circulation, or C. We're talking about the heart and the pumping of the blood in the chest there. So if there's chest pain, if there's poor blood pressure, poor coloration, that would be a circulatory problem and an emergency. And D, disability, neurological. If someone has had a change in their mental status, if they've had a change in their balance, they're dizzy, they're having control issues, they're having trouble with their motor function, they're having trouble with their sensation, the way they hold their face, the way they're structuring their thinking, slurring their speech, visual changes, auditory changes. All these things constitute neurological change and would constitute an emergency. So really, if a diver comes up or in the water is having trouble in this area, chest, lungs, heart, brain, neck, airway, all these things, let's not fool around. Oxygen, immediate aid, CPR if necessary, 911, emergency transport. If it's dive related, even if we're not sure what the diagnosis is at the scene, let's try to get them to the Roper ER so they're closest to the hyperbaric medicine chamber. But if you're away from here, the nearest full capacity ER for resuscitation and stabilization, and then identify the diver as a diver and that the problem may be dive related, so that after stabilization and initial testing, the hyperbaric medicine department is contacted. Okay, so A, B, C, D. If it's an emergency, let's go the emergency care pathway. Let's use the resources, use the ambulance, use 911, and the chambers come next. There are many problems that can occur underwater that are not bubble problems and don't require chamber treatment, and the emergency department, in consultation with the dive medicine staff, may need to sort those out. Some of the problems might be surgical, and we'll go through that in the dive medicine video modules. Now, if there's an obvious problem, airway, breathing, circulation, disability, that requires emergency treatment, most of you are going to get that right off the bat, and you're going to get nervous and you're going to call 911, and that's good. Now, let's say it's a more minor problem. Let's say you're a diver and you went for a very benevolent dive, you stayed within your tables, you did everything right. Maybe you came up a little fast or you stayed down a little long, but you think you did everything right. Everything's fine after your dive. A couple hours later, you know, it's getting in the evening, you got a little ache in your elbow. You can't remember that you did anything underwater that should have tweaked that or sprained it. And now you've got unexplained elbow pain. Maybe you did sprain it, maybe you're not remembering, but it might be type 1 decompression sickness, and in short order probably ought to be evaluated and probably treated. One of the mantras I use in dive medicine is, when in doubt, press it out. When in doubt, press it out. That means we don't always know. There is no great test for mild decompression sickness. We do it based on the history and as sort of a, we don't know what else it is, so we better go ahead and treat them if it's related to diving. And sometimes we may treat people who have a sprain but usually we know if they feel really significant relief by the time they get to treatment pressure in the chamber, we've made the right guess. And if occasionally we treat a sprain that seems like it might be decompression sickness, no harm in that. We try to do a very good job of teasing this out and getting a detailed history, but just don't always know. So now let's take you back to that scene. You've been diving. A few hours later, a little while later, you're not feeling completely normal. You don't feel any threat to your airway, breathing, circulation, or central nervous system. You simply don't feel something is right. So that's when you would use our on-call system. Our phone number here at the unit is 843-724-2014. Reverse your video and play that back again, write it down. It's also on the dive safety document, which is on this website. It's published on the website, and certainly you can call the main hospital operator 724-2000 2000 and ask to be connected to the hyperbaric medicine department. If it's during office hours and we're here, we'll talk to you about it. We might just say, come on in, register you as a patient, evaluate you, and probably put you in the chamber for a dive. When in doubt, press it out.